The program that we are part of is called Survivors Teaching Students Saving Women's Lives. And it was started through the Ovarian Cancer National Alliance. A couple of women got the idea that maybe this would be one way to get the word out about ovarian cancer, the symptoms, the risk factors. And it's now in about 50 to 60 medical schools throughout the country, and we're working hard to get it everywhere, all medical schools, and then starting on nursing schools and the nurse practitioner programs and that kind of thing. And our goal really today is to increase awareness and understanding of the symptoms and the risk factors of ovarian cancer so it can be diagnosed early. I am a 12-year ovarian cancer survivor. I was diagnosed with stage 1 when I was 56 years old, I think. And my case is really kind of the way you want it to be diagnosed in stage 1 and not to have a recurrence since then. I did have clear cell, which is an aggressive type of tumor, but I was very, very fortunate that I did have some symptoms, but I did wait until I had my annual exam, which was not a good idea, to come to the doctor, and he found the tumor right away, and then I was operated on within 2 weeks. I went into the operating room thinking I was fine, that it was just a fibroid, and came out of the operating room and found out differently. I don't know how much you all know about ovarian cancer, but maybe previously to starting this rotation, you may have heard that it was a disease that's called the silent killer because the symptoms are vague, and they can be symptoms of other illnesses, and usually are, as opposed to being diagnosed as ovarian cancer. It is when it's diagnosed in the early stages, stage 1, stage 2, the survival rate can be as high as 90 or 95%. But when it's in the advanced stages, the survival rate for 5 years can go as low as 30%. So you can see there's a huge difference from early detection versus later detection of the disease. One of the things that a lot of doctors learned when they were in medical school, that there were no symptoms, and we know now that that is not true. There have been a number of studies done over the past 10 or 12 years, and most women have some type of symptom. They may not recognize it right away, they just know that something isn't right. And they go to the doctor, and the problem is so many are diagnosed with irritable bowel, stress, diverticulitis, and by the time they do get the diagnosis of ovarian cancer, it has spread and is into stage 3 or stage 4. To us, it's so important to get the word out. The mission of our coalition is to educate, raise awareness, to increase the survival rate and the quality of life with women who are affected by ovarian cancer.